is Rupen. I'm an internal medicine resident and a future hematology and oncology fellow. And today I want to share with you one of the most amazing tools I used ever. It's called ChatGPT. It's an amazing tool and it was released in November 30, but I will not tell you about it. Let's see together what is this tool and what it can do. Let's go.
Okay, so as I said earlier, I'm an internal medicine resident, and I'm gonna go to do hematology and oncology in Detroit hopefully soon, and I'm very interested in the abilities of AI and how they can help us on a daily basis. How I heard about this tool, one of my friends sent me a link to a podcast that was published recently on the Daily. The New York Times did artificial intelligence just get too smart, and it's an amazing podcast. They explain the tool very well. So I'm gonna let you listen to the podcast on your own time. I will. So ChatGPT, it's founded by OpenAI, and OpenAI is a non-profit research company. Aims to develop AI in ways benefit humanity as a whole. And as usual, Elon Musk's name is there. Thank you so much, Elon Musk. Big fan. I really appreciate what you've been doing for humanity as a whole. Big believer, big fan. Thank you so much. And so this tool was developed by this company, and now it's available there for us in the society to use. Okay, so ChatGPT optimizing language models. So it's a chat box that you can literally chat with an AI, and AI can answer your questions. That's it. Whatever you want to ask AI can answer the question. But of course, it has its own limitations. You can go through the website, and if you just go to ChatGPT, you do Google search, it will appear first. It shows you how ChatGPT can help different people, but I'm very interested from the medical standpoint, how it can help me as a physician. Okay, so and they are talking here about ChatGPT. I will let you to discover this tool by yourself. We will see what it can do to us as a physicians and how we can benefit patients. Okay, so let me log in here. Try ChatGPT. Okay, and then I will also show you UpToDate. UpToDate, for people who don't have medical background, it's one of the most used tools, I would say, by clinicians. Lots of clinicians have access to UpToDate, and UpToDate help us on day-to-day basis to figure out how to approach patients. For example, if I have a hypothetical patient who presents with shortness of breath, and I'm not sure if I'm so this is very simple presentation, and most of physicians know how to approach shortness of breath, but let's go with something simple. If I don't know how to approach shortness of breath and I want to look that up, so I can just go to UpToDate and search approach to shortness of breath, and I click on this, and it will give me a paragraph or like an article with all this information, and then summary, and then graphs, and then tables to show me how to approach shortness of breath. Okay, so let's assume I'm a family physician. Okay, sorry, so it's asking me connection is secure. Let's assume I'm a family physician or I'm an internist, and a patient presented to me with shortness of breath. So very interesting. I'm gonna now say write a consult note. Okay, so I will put the data. 45-year-old patient presented with worsening shortness of breath for the last 3 weeks, period. He describes orthopnea and PND, period. He also reports increased swelling in his legs, period. His past medical history is significant for diabetes, hypertension, COPD, period. He is a chronic smoker with 35-pack smoking history, year, period. Social history, he lives alone, drinks occasionally, works in the government, period. Allergies, pollen, sulfa, period. No previous surgeries. Sorry, it stopped. So I'm just using Apple here to dictate. I'm just going to no previous surgeries. period. I'm just going to add here allergy, okay, sulfa, no previous surgeries, allergies, medication, we talked about social history. Okay, so, sorry, I'm just going to write a consult note, 45. So this is a typical patient that usually we see in bread. So this is a bread and butter case for internists. Okay, let's say I have this patient. I asked ChatGPT to write a consult note. Okay, let's see what can this tool do. Okay, this is a scary. This is like very organized. Wow, it's creating assessment and plan. Just a second. Unbelievable. I'm scared. Just a second. So 45-year-old male, shortness of breath and swelling in the legs. The patient reports worsening shortness of breath in the past 3 weeks, along with orthopnea and paroxysmal nocturnal dyspnea. He also notes increased swelling in his legs. The patient has a significant. So this is a present for those people who don't have a background in medicine. So I'm just giving a presentation that is concerning for congestive heart failure. Orthopnea and paroxysmal nocturnal dyspnea, it means shortness of breath when you lie down flat on your back, and paroxysmal nocturnal dyspnea, it's shortness of breath and you wake up in the middle of the night gasping for air. Swelling in the legs is edema. Those are signs of heart failure. Past medical history, so it's organized the information well. Diabetes, hypertension, COPD, is a chronic smoker with 35 pack years smoking. Wow. So I did a mistake here if you noticed. So I put he described orthopnea and PND, where is the smoking? He's a chronic smoker, 35 pack, smoking history year. So I did a mistake, but ChatGPT was smart enough to, unbelievable. The patient lives alone and drinks occasionally, reports walk. Okay, so I think it's working. I think Siri did a mistake here when walks in the government. Okay, it's working in the government. Allergy, patient for sulfa allergy, no previous surgeries. Given the patient reported symptoms and past medical history, his shortness of breath are related to his COPD. Okay, so this is a unique problem. So his shortness of breath and this leg swelling could be secondary to COPD, but usually COPD is exertional shortness of breath, swelling of the leg, and shortness of breath that when you lie flat, it's more characteristic of heart failure. But okay, so related to his COPD and possibly also his diabetes and hypertension. Diabetes won't cause you shortness of breath per se. Further evaluation included physical examination. Okay, that's interesting. I will do that as a physician. Pulmonary function test, possible imaging studies. That is very interesting because I think the next step in this patient, I'm going to order an echo. Echo, it's a way of looking at the patient's heart, and it tells us the function of the heart. So yes, I need imaging, and we're necessary to confirm the diagnosis, determine the appropriate management. This may include medications, lifestyle, of course, lifestyle modification, very important. We always recommend oxygen therapy as needed. So this is not accurate. Oxygen therapy, it's not indicated because here, first, we don't know what is the cause of the patient's shortness of breath, and the second, we don't. There are certain criteria that the patient should meet to give him oxygen. Refer to pulmonologist may also be advisable. Overall, it will be important to closely monitor the patient's symptoms and response to treatment. Unbelievable. Okay, so let's give this AI some blood work. Okay, so Siri, I will need Siri's help now. CBC showed hemoglobin 110 milligram per deciliter, comma, MCV 75, comma, INR 1.1, comma, sodium 134, comma, potassium 4.5, comma, chloride 102, comma, BMP 1500, period. What is the best next step? Question mark. Okay, so so the BMP, for those who don't have a medical background, BMP is a marker of it tells us if the heart is having difficulty pumping the blood. So there are many reasons, and one of them is heart failure. But here I'm generating typical presentation of heart failure, and there is a bit low sodium here. So that we call in medicine hyponatremia. Okay, so I'm asking ChatGPT what is the best next step. Let's see. based, it appears the patient has anemia, low hemoglobin level, and possibly also dehydration. Okay, the elevated BMP may suggest. Okay, so that's interesting. So it caught anemia. That's good. Dehydration. So the low sodium here is something that we see. Okay, I'm just gonna wait ChatGPT to finish. This is crazy. This is crazy, unbelievable. So it appears that the patient has anemia. That's right. Possible also dehydration, low sodium, and high potassium levels. Fair enough. I agree, but could be, yeah, because like again, patients with heart failure, they have decreased appetite and they don't eat a lot because there is lots of fluid congested around their belly, around their small intestine, let's say. Probably, yeah, that's not wrong, I would say. Elevated BMP levels may suggest heart failure. That's right. The next step will depend on the patient's clinical presentation and other relevant information. It will be important to further evaluate the patient's anemia and determine the underlying cause. Additional laboratory complete blood count, iron studies, and imaging studies. So iron studies, I agree, we need iron studies, but I don't agree with the imaging studies. Management of patient anemia and dehydration may include administration of fluids and blood transfusion. Okay, so this is not accurate, but again, this is so impressive. This is in the infant stage, and the patient, and the ChatGPT can identify things. The elevated BNP levels and positive heart failure should further be evaluated and managed as appropriate, which may involve referral to cardiologist and initiation of appropriate medications. Wow. So now it's asking me to refer him to a cardiologist. Overall, it will be important closely to monitor patient symptoms and response. Amazing. Okay. So let's say I don't know what is differential diagnosis of shortness of breath. What is the DDX? That's what we use for differential diagnosis, which means the different causes. What is DDX for? Okay, so I'm going to make it harder. SOB, shortness of breath. So this is medical slang. DDX means differential diagnosis. SOB means shortness of breath. And let's see what ChatGPT will show me. Shortness of breath. Oh my God, it organized them. This is unbelievable. Physical causes, pregnancy, it's important to consider. Okay, so now let's compare this. Medical history. So it's always giving me recommendations to consider the entire picture, which is accurate. Okay, so it gave me 4 causes. Okay, so let's go to up to date, which is what we use in medicine, and shortness of breath. Okay, so this is summary of and recommendation, clinical assessments. Okay, common causes of chronic dyspnea. Oh, so I did not identify chronic dyspnea. I just said shortness of breath. So table 7. Okay, so upper airways, chest, abdominal wall, pulmonary. So it is more comprehensive. Again, you have to put the clinical picture into the context of these different causes, but it covers like the cardiac, pulmonary, chest, abdominal wall, upper airways problems, toxic metabolic problems, and miscellaneous, anemia, renal failure, thyroid disease. And now let's compare this with ChatGPT. And cardiovascular, exactly accurate. Pulmonary, exactly automatic. Anemia, hyperthyroidism, metabolic acidosis, obesity, panic disorders, pregnancy, obesity, high altitude. So it's pretty accurate. It did not talk about upper airway causes, which are usually not, it's not that common. Most common causes are pulmonary and cardiac. Okay, this is amazing. Okay, so let's make this a bit more difficult. So a couple of weeks ago, I had this patient who presented with fever and thrombocytopenia. Thrombocytopenia means low platelets. Okay, and it's not common, sorry. The patient was eventually, I will not tell you eventually what the diagnosis was, but like, let's say I'm in the hospital and I was asked to see this patient who is presenting with fever and low platelet count. And I can't really recall the differential diagnosis, for example. Okay, so what is the differential okay, so no. What is the DDX? DDX of fever and thrombocytopenia. Alrighty. Unbelievable. Fever and thrombocytopenia, wide range of causes. Infectious, yes, I agree. HIV, bacterial infection, fungal infection, systematic. Okay, that's right. Okay, medications, I agree. Okay, alcohol, it is important to consider patient. Okay, so alcohol abuse, medications, hematological causes, autoimmune conditions, very organized way in presenting information. I'm very impressed. Okay, so let's go to up to date. Okay, and now let's search fever and thrombocytopenia. Severe fever with thrombocytopenia syndrome virus, diagnostic grows to adult with unexplained thrombocytopenia. Okay, so severe fever with thrombocytopenia syndrome. So this is, it's talking about the syndrome, like usually it's infectious causes that causes. So it's talking about viruses, epidemiology. I think they are talking specifically here about different viruses that can lead to fever and thrombocytopenia. And this is one of the causes. It's not like leptospirosis, ehrlichiosis, HLH. So those are different infections. I will see if there is Lyme. There is no Lyme disease. So my patient was diagnosed with Lyme disease. So even an article in up to date in about thrombocytopenia. Okay, so let's look here. So my patient eventually was diagnosed with Lyme disease. Diagnostic approach to adult with unexplained thrombocytopenia. Okay, it's not mentioned. Okay, so going back here, even here, as I said, Lyme disease is not mentioned. Okay, but again, like Lyme disease does not usually present with thrombocytopenia. It presents with more joint pain, rash. So it's a rare condition, or let's say rare presentation of Lyme disease in my patient. So neither up to date nor like ChatGPT was able to give me quite like, or like either like highlight Lyme disease. Here again, it's not typical presentation. So in situation like this, in my patient who presented with fever and thrombocytopenia, we did extensive workup. We started with basic blood work, including CBCs, electrolytes, extended lights, liver enzymes, and then we did like some imaging of the chest and the abdomen because we were thinking about malignancy. We sent some markers of autoimmune condition that was negative, but one of the things that remained unexplained is ordering broad infectious workup, and that's why we ordered Lyme disease antibodies. They came back positive. One thing also, this patient's presentation was in November, and when I talked to him, he mentioned that he used to spend time outside, but he did not recall any tick bite. So it needed some human judgment to, so let's add that component. Fever, okay, what is the cause of fever and thrombocytopenia in patient who spent time outside? Be vague and let's see what. Fever and thrombocytopenia in a patient based on the fact that they spent time outside alone. There are many potential causes. Okay, so let's see. Viral, bacterial. History of autoimmune disease. That's what we did. Like we did autoimmune workup, 10 medications, autoimmune medication-induced causes. It is important. The patient's including thorough physical exam. Yeah, I agree. So here the human component, the human thinking was very important to figure out the differential diagnosis or to diagnose that patient who presented with very vague presentation. Okay, so this is ChatGPT. Let's say something else. So on daily basis, we also write progress notes. Okay, write progress note for. Okay, let's take this presentation. Okay, and let's put it here. Okay, write progress. Okay. Okay, so like, yeah, I agree. It's not that a huge difference here because based on the information that I gave ChatGPT, there are different ways of. So here, like, oh my God, just a second. So it's interesting because if you compare chief complaint and assessment and plan, so it immediately jumped to the assessment and the plan. And yes, it is different from the consult note. For the consult note, is more detailed. So it includes history of present illness, past medical history, social history, allergies. And here it is shorter, it's more concise. And yeah, it fits the criteria of progress note. But again, I think I should look into this when I should give ChatGPT different data. Will follow his primary care provider in a week to monitor his progress and adjust treatment as needed. Overall, the patient's shortness of breath and leg swelling have improved with treatment, but it will be important to continue monitoring these patients. Amazing. Okay, so I see this tool, it's going to be amazing tool for clinicians in the future. If Elon Musk is hearing me, I'm a big fan. I'm more than happy to give more feedback on this tool. It's amazing. I'm so impressed. Like, I can give million scenarios how this tool can work in the healthcare, and I see the future of this. I think tools like this will help us as physicians to practice medicine again and have more interaction with patients, and not spend time documenting and not spend time writing notes, putting orders in. This tool can bring, hopefully the future product of this tool can bring medicine to can help us to practice medicine again as we should, by talking to patients, by caring for them, by listening to them, and not spending much time in documentation and putting orders. Okay, if you have other ways of using this tool, if you have any other suggestions or any comments, please let me know. I'm more than happy to do other review of this tool. If you use this tool in different areas of your life, please let me know. I'm very interested. I'm very passionate about this. I will see you in the next episode. We will do a review about something else. I will be reading your comments, guys, and please hit the subscribe button to the channel, leave me a comment, and follow me on Facebook and Instagram. Okay, cheers. I will see you next time.